Hello, everyone. My name is Dr. Lisa Laurent, and I'm the Market Chief Medical Officer for Central Iowa MercyOne. And this is Chief Chat, an unscripted, informal, off-the-cuff conversation with people in the know who you need to know from MercyOne. Today, our very special and esteemed guest is Dr. Richard Deming. We're actually sitting in the Richard Deming Cancer Center. It is emblematic and espouses the vision and the passion and the commitment to excellence that Dr. Deming demonstrates each and every day. Dr. Deming, there's so much to discuss in this beautiful cancer center, but I'd like you to share with our audience what you feel is the most important message you'd like to convey about the Richard Deming Cancer Center.
Lisa, thank you so much for having me on the program. It's just a delight to share with you what we're doing here at the new Richard Deming Cancer Center. What this center represents is really the culmination of decades of cancer care that has been done at MercyOne Des Moines by folks that were here before I came, by the colleagues that I've worked with. And I just am so honored to be able to be part of this new space that brings new programming to the Cancer Center. We have created a space that allows us to complement our already wonderful Cancer Center with additional services. So let me tell you a little bit about what we're doing up here at the Richard Deming Cancer Center. We've created 4 brand new clinics. One clinic that we do here is called our Multidisciplinary Cancer Clinic. So the old-fashioned way is a patient's diagnosed with cancer, they see one doctor, and then that doctor takes that patient to their scheduler, and that scheduler calls the scheduler to another cancer doctor's office, and then they see that cancer doctor, and then before you know it, a month may go by. What we do here at our multidisciplinary clinic is a patient who's just been diagnosed with cancer, for example, lung cancer, will come with their family, and in one appointment in a beautiful suite of rooms, they will see the lung doctor, the lung surgeon, the radiation oncologist, the medical oncologist, all in one setting, have a care plan formulated and get their treatment started. So that's one of the clinics. The second clinic that we started here is our survivorship clinic. So there are 17 million cancer survivors in the United States. When me and all my baby boomer friends start getting our cancers, there's not going to be room in the active cancer treatment area to be taking care of all the patients that need cancer treatment and providing the really superlative care that cancer survivors that might be 5, 10, 20 years out deserve. So the Cancer Survivorship Clinic is paying attention to the physical, psychosocial, emotional, philosophical, financial, spiritual needs that cancer survivors have after their cancer treatment. A third clinic that we've created up here, and it's really the one that is closest to my heart, is for patients living with incurable cancer. Living with incurable cancer is very different today than it was even a decade ago. Now with targeted therapies and immunotherapies, patients that have an incurable cancer may live years or decades, but have very special philosophical, emotional, psychosocial, and spiritual needs. So as I said, we're not doing the radiation up here, we're not doing the chemo up here, we're doing the surgery here, but it's a philosophical approach to how do you help individuals living with incurable cancer find joy each and every day in spite of a diagnosis that will eventually lead to their death. And that leads us to the 4th clinic, which really isn't a clinic, but a way of taking care of patients. And that's what we call integrative medicine. So integrative medicine is bringing into the cancer center services like massage therapy, acupuncture, chiropractic care, mental health counseling for patients, mental health counseling for the family members, mindfulness practices, art therapy, music therapy, financial counseling, nutritional counseling, sexual health counseling. All of those are services that are available to patients and their family members. And what's really wonderful is that we had a capital campaign that raised $16 million, and part of that goes into an endowment to help provide all of those integrated medicine services that aren't reimbursed by insurance free of charge to all patients. And the integrated medicine services are available to patients that might just have been diagnosed with cancer, or just getting started with treatment, are in the middle of treatment, are cured of cancer and are coming back as a survivor, or are on a journey with incurable cancer. So this is a vision that I've had for many, many years, and due to the philanthropic support of the hospital, of the community, and of all of the other practitioners that are part of the MercyOne Cancer Center has come to fruition this year. And we're just so excited to share these services and help improve the health, the life, and the joy of individuals wherever they are on their cancer journey.
Thank you so much, Dr. Deming. It has been an unqualified pleasure to speak with you today. There is so much more to learn about you and the Richard Deming Cancer Center. So everyone, this is part one of a two-part series. So stay tuned in September, where we speak more with Dr. Richard Deming and do a tour of the Richard Deming Cancer Center. Until next chat,